The Hub is presented to you by Calvo Enterprises, Inc.
Guam has taken great pride over the years as the community with the highest per capita U.S. military enlistment rate, which also means we have a similarly high rate of military veterans. The island and the country are grateful, of course, for the service of these men and women, and a new law was passed recently to specifically help veterans who were exposed to harmful chemicals such as Agent Orange and those emanating from burn pits. The Regional Veterans Affairs Office will be reaching out later this month to affected vets to identify them and to provide some general health services to those who might not otherwise be eligible. Coming up on the Hub, a discussion on the Promise to Address Comprehensive Toxins Act, or the PACT Act. Don't go away.
The Hub is presented to you by Calvo Enterprises, Inc. The Hub is presented to you by Calvo Enterprises, Inc.
Good day, everyone, and welcome to The Hub. I'm Nestor Lecanta. Joining us this week are Dr. Kevin McDermott, who is the Guam VA CBUC Chief. CBUC, of course, is the community-based outpatient clinic, and Amy Rolfs is the Public Affairs Officer for the Pacific Islands system overall. Amy, we brought you guys on to talk about an upcoming event, which is the PACT Act registration and community call event. And let me just start the conversation with you. Tell us a little bit more about that event.
Aloha from Honolulu. Thank you so much for having us on. This is going to be our third PACT Act community call. And PACT Act is the promise to address the comprehensive toxins. It's a new law that enables our veterans who have been exposed to toxic substance such as Agent Orange and burn pits. And so we've been registering our veterans for the last couple of years for this new law so that they can expand VA healthcare for them, because some veterans otherwise would not have qualified for VA healthcare. And so this January, the 27th and 28th, we will be out at the Agana Shopping Center, and for a two-day event where we'll be providing our veterans with the PACT Act registration for veterans who have not registered at all for their health care to come out and they can register for their health care. But we'll also be providing, when we say community call, that is like a house call. We're bringing the healthcare services to them in the community, and that includes some vaccines. You can get your flu, you can get your COVID updates, the new COVID vaccine. We can also give them some health services such as a blood pressure check, a diabetic foot check, and some health tests that's available for them, like HIV tests. So these are the kind of services we'll be providing during those two-day events. And like I said, this is our third one that we've done. The last time we were there, we saw more than 500 veterans. We registered more than 500 veterans. And the one even before that, we saw almost 1,000. And so to date, we have registered through these events in the community close to 1,300 veterans.
Yeah. Before we get more into the weeds of how they can come around and register, I wanted to ask Dr. Kevin McDermott. Doc, we, as we know, have one of the highest enlistment rates in the country, and as a result, we've got thousands of veterans on Guam. And Amy mentioned the PACT Act, and it's what its purpose is to be able to respond to those who may have been exposed to chemicals such as Agent Orange and the burn pit chemicals, and that's been the case on Guam as far as we know, that there has been a lot of exposure to it. So talk a little bit about that, Doc, and how many patients you may have seen showing those kinds of symptoms.
Definitely. So statistics on Guam, as we all know, are sometimes a little harder to put a finger on. So exact numbers are challenging. We do know that a lot of our patients are not only exposed to these things more, but have higher levels of illness, poorly treated diseases. personally in the clinic, we see every day people potentially with these toxic exposure side effects from things like diabetes, prostate cancer, skin diseases that we are trying to treat and capture. Our overall mission is to improve the health and healthcare of Guam. This is one of those opportunities to try to get those people to come back, to get seen in clinic and get treated for things they may have not been treating as much or as well in the past. So please, this is our continuing push, our efforts to try to get people enrolled.
Yeah. And for those veterans, what are the kind of the signs, the health signals that should prompt them to come in to see you?
Very frequently, our goal is potentially even before signs. One of our biggest measures is preventative care. I would love people to come in before they have these signs. But unresolved skin rashes, problems with urination, chronic fatigue, chronic pains, please come by and get checked. Some things are potentially normal, but a lot of things are not. And really the only way to really know is to be checked out, to have some of these tests, labs, exams performed.
Yeah. And Amy, having covered veterans issues over the years on Guam, what I've found was that there's been a apparent reluctance for a lot of these veterans to come forward. Can you talk about that and how this, community call and outreach event might be helpful in getting these veterans to come forward?
In all the times that I've been to Guam, and I've been doing this now since 2015, and I've talked to many veterans, and it's some of them find it challenging just to get to some of the appointments. Some of them find it challenging to get the care that they need. So we always say it's never too late. Don't hesitate. It's been so long since I've gotten out of the military. It's humbug. It's too much work to do the paperwork. So I tell them, you know what? That's why we are here. That's why we bring a team of member services who know how to register our veterans. They need their military ID card. If they don't have their DD-214, all they need is their social security number and an ID card. If they have their military ID card, their retiree card too. Some of them realize, they think, oh, the VA is not for me. I retired. I have TRICARE. What we try to tell them, they are still also eligible and qualified to get VA health care. So please come out and just ask your questions. We'll have providers there. We'll have pharmacists there. We'll have Dr. McDermott and his team, all the CBOC staff, to come out and meet them. And just bring your questions, right? Just be informed and educated. And that's really our goal every time we bring these services out to the community.
Yeah, and Doc, Amy mentioned earlier that the first year you had 1,000 vets sign up, and the following year 500. So this sort of public outreach, has been pretty successful, do you think?
I do. I think a change in a venue, different opportunities, going to the people is very successful. Guam is also a large word of mouth kind of community. So going to where people are at, showing our faces, trying something new, I think is what is wanted and needed. A lot of our patients can have feelings of false promises, broken ideas. This is us continuing our promise. We are coming by. We are there in person to see them where they're at. And so this is the venue to have a change of heart if you want to, and maybe spread that word. Maybe you didn't know, or you don't think about this kind of thing. Come see us in person. Ask us that question. We'll have many people to answer.
Yeah. And Doc, what have you found to be the more common ailments that you see at the clinic?
Unfortunately, and this kind of relates to a lot of that toxic exposure aspect, a lot of people in Guam have cancer, pre-cancer, diabetes, and blood pressure problems. And often they don't know until they're at aggressive stages, or they're too scared to know. And so they find themselves in the scenario where their loved one has had medical issues and they themselves are reluctant to have that investigated further. And that could be a main reason why not to come. But a lot of these times, these people really just need to have a moment to sit down and reflect on taking care of themselves and not let past impressions persuade them for future help. I think a lot of people in Guam have difficulties that everything will just be the same forever, that there isn't ways to make things different or better. We're just so far out of the way. I don't think that's the case. I think a lot of high quality care, a lot of good services and people can be delivered.
Yeah. And Amy, Dr. McDermott makes a good point. There are a lot of those cases that I've seen and heard about, the vets, especially the elderly ones saying, I'm resigned to this sort of, fate. And I'm not going to bother, and I'm too old. What do you say to that? And how do you reach out more to these folks in particular?
It's for me, whenever I'm at these events and I meet veterans who for the first time are actually coming. I have met just recently a veteran who is 103 years old, has never gotten his VA health care, and his daughter brought him out. So it was really heartwarming just to listen to their stories of their experiences. And a lot of them are humble, and a lot of them think, oh, I don't need, right? Give it to someone who could use it. And I'm thinking, no, it's not charity, right? Don't feel like we're giving you a handout. Their pride is like, oh, they've earned it. This is what I always tell them. This is not something that we're handing out as like charity. It is what they have, the services they have earned. This is services that they, because of their service, their honorable service, that they should be receiving. And like the PACT Act, they need, if they're not registered, they won't know of the new different services and benefits that are out there.
Yeah, that's quite a story. 103-year-old and who has been eligible and for all those years never came forward. That's quite a story. All right, we got to take a quick break, but we'll be back to talk more with Dr. Kevin McDermott and Amy Rolfs about the VA and the services and the upcoming event. Please stay with us.
The Hub is presented to you by Calvo Enterprises, Inc. The Hub is presented to you by Calvo Enterprises, Inc.
All right, we're back, and we're talking with Dr. Kevin McDermott and Amy Rolfs of the Veterans Affairs, and we're talking about an upcoming event later this month, an outreach event of sorts for veterans on Guam who may have been impacted by chemical exposure, such as Agent Orange. This is as a result of the PACT Act. And Doc, let me just go back to that. For those who might not be familiar with the PACT Act, talk about what it was for and how recently it was passed, and why they should avail of the services that are available through the PACT Act.
A lot of our patients and a lot of veterans aren't always aware of benefits they get. A lot of people leave the military service, depending on what era you were in, with little more than just a thank you and have a nice day. Many people should and are eligible for treatment for many things that happen. This is another outreach, like many other outreaches before, that try to increase that eligibility and knowledge for services that are available for veterans. The PACT Act specifically is involving these toxic exposure screenings. Over time, the military, being a military service overseas, people have been exposed to different things. We don't know all the things. We don't know all reasons for answers, but we do know that some exposures have led to higher instances of some illnesses. Some that are very well known are like Agent Orange, like the burn pits, Gulf War illness, some other ones. The goal of this is to start a dialogue. Hi, you seem to be suffering with some kind of problem, and you have an extensive military exposure for things. Can we help you with those medical needs? Can we treat you? Our goal is, if anything, very benevolent in this regard. We're here to give you the services to potentially treat some of your problems that maybe you've ignored, accepted, or don't even think about and just think is normal. And a lot of the time, you don't even know. We're here to give you the opportunity to know.
Yeah. Amy, you want to kind of expound on that? You've been, taking part in these for the last couple of years, these events.
Yes. What I also wanted to add are spouses and survivors. And so they are also covered in this new law. So if they're a veteran, if they've passed away of any kind of Agent Orange exposure or toxic burn pit exposure, or anything that they would like to see if there are benefits for them, this new law covers spouses and survivors. So I bring that up as a spouse myself. I wouldn't know, right? But I have encountered wives who are and children who know that their father or husband passed away due to Agent Orange. So come to our event with proof of the veteran passing away of that, and there are now benefits for our spouses and survivors.
Yeah. And Doc, I know that this upcoming event is primarily geared toward the PACT Act, but here's another kind of sensitive subject that's touched on vets over the years, and that's mental health. Will you be able to address any of those issues at this upcoming event?
Definitely. And part of many of our screenings includes things like mental health. We'll have one of our mental health providers there and to also assist with any kind of issues. And your question brings up a really great one. Even though this is focusing on PACT Act, it's focusing on toxic exposures, our goal is to have people get healthcare. And whatever our sales pitch might be, whatever care we're offering, the answer is come by, register. We'll get you a primary care doctor. We will get you a mental health provider, and start maybe some services that you've maybe needed before you didn't know you could have, or didn't think were beneficial to you. Please come by, mental health or medical need. Would love to help.
Yeah. Amy, you want to talk about that too? I know that's been a sensitive issue. People in general are reluctant to talk about that, but vets in particular, I think, because they're soldiers, they're supposed to be strong, kind of thing. Talk about that, Amy.
So here's the population I want to do a shout out to. When we think veteran, we think men. I want to shout out to our female veterans. This is an underutilized service that our women veterans they don't come to get their VA services for whatever reason, and I'm wanting to encourage that. I know that I just recently talked to Dr. McDermott about the services we provide. Especially specifically for our women veterans. And when I come, I do meet, greet, be the spouses, but also I enjoy talking to our female veterans, because a lot of them just don't realize what services we can provide for them. Right, Dr. McDermott?
Yeah,
Very
and
much
my
so.
apologies. I didn't mean to exclude women. Absolutely, they're just as strong and just in many cases as needy as the men vets. Dr. McDermott, go ahead. I'm sorry.
One of our many populations are less talked about is the female veterans. In Guam, around, at least that we know of, about 10% of our veterans are female, and of that, not that many are necessarily registered. So it's even a harder group to kind of put your finger on a little bit. But yes, we offer just as many female centered services as we do anything else, from mental health and beyond. And I think overall you're touching on some big points of healthcare is tough and challenging because it is varied. And some things people don't talk about. The female veterans have their own issues. Mental health has its own issues. And that's the nature of medical care and general health, is that it is a safe space for you to come, be heard, and treated if needed.
Yeah. And while I got you both here, I did mention before we started the show that had an opportunity to speak with Dr. Adam Robinson, who's your guys' boss, oversees the Pacific Islands for the Veterans Affairs. And we talked about the Dedido outpatient clinic annex over at the, going to be built next to the Guam Regional Medical City. So maybe talk a little bit about that for those people who may not have heard about that.
So on November 16th, 2023, we did issue a press release because our Guam Community-Based Clinic Annex lease was released, and we're very excited to announce that award of the lease for 5,000 additional square feet, which will help expand the care offered for our veterans in Guam. On behalf of Dr. Robinson, I know that we are very excited to provide more primary care, prosthetics, labs, and in-person mental health. And so it'll significantly help Dr. McDermott and his team out there in Guam to expand the services, because I know that our little clinic that's there currently will really benefit from this expansion.
Yeah, and Doc, you certainly need the additional space. Are you going to be able to find some staff to cover it?
My goodness, my staff is excited, and I'm always recruiting. Before this phone call, we were hiring more staff that I was working with HR with. Our overall goal is that we listen to the patients here, what they have to say, and we are trying to take that feedback into account. One of our common feedback is our space is too small, that we need more services. Here we are. We have additional space, additional services in person, and staff to be there to provide it.
All right. So we got a couple of minutes left, and I just want to give you both an opportunity to kind of pitch the upcoming event, the dates and times, and the locations. Amy, let me start with you.
Okay. Please come out. We have ads running in the newspaper. We have it on social media. Please get the word out to our other veterans who may not have, digital media, who may not have access to the internet. On January the 27th and the 28th, we're doing this on a Saturday and Sunday because we're finding that it's an opportunity to have people who work come to our event. There will be a PACT registration and community call, and it'll be from 10 a.m. to 6 p.m. at the Aganis Shopping Center, and that is 302 South Route 4, and in room 223. It's the second floor. So please, no registrations required. Bring your ID card, and we'll be able to register you for the PACT Act and provide you with some health services that you have earned.
All right, Doc, you want to wrap us up and invite some folks to come down?
Yes, and whoever's listening to this, even if you are registered, I know you have some WhatsApp group, Facebook group, chat, meeting at Shirley's. Send a message out. Tell someone who has been reluctant to come by, invite them just to come see. Walk on by during your morning laps and just enjoy what we have to offer. If nothing else, just to see that we are trying to change and improve things around here.
All right. On that note, that's Dr. Kevin McDermott and Amy Rolls of the Veterans Affairs Office. I'm National Accountant. Thanks for watching, everyone. We'll see you again next week on The Hub.